Hello again, everybody. This is Dr. Bulow with Revive Upper Cervical, and this week we've been talking about ENT health issues: ears, nose, and throat, headaches, neck pain, trigeminal neuralgia, things along those lines, TMJ disorders. And recently we've been talking about tension headaches, something I like to call dashboard headaches. Dashboard headaches, what are dashboard headaches? They're my way of describing your common everyday tension headache. Well, what is a tension headache? A tension headache is a headache that has a band-like distribution, like you're wearing a hat that is too tight for your head. Or a tension headache can be like the headache that starts at the back of your neck, the top of your neck, and goes up the back of your head. They're fairly common headaches. And they're kind of like the dashboard indicators in your car. They're there to tell you that something's not quite right. And they're also fairly common. A lot of people, when they go through life, that you've had probably an occasion where the light on your dash pops up saying that, there's something going on. Well, what do you do when that happens? A lot of people, believe it or not, will totally ignore it. And that's what happens with a headache. A lot of people will totally ignore it, or they'll take a Tylenol for it, and I'll ask them, do you get headaches? And they'll say, well, I get the regular amount of headaches. And I'm always kind of surprised by that response. What is a regular headache? That's like asking someone, does that engine light ever pop on in your car? What if someone said, well, like every once a week, and no big deal. So that's kind of an odd thing, right? You probably should look into that. You should probably find out, why is that check engine light turning on? Because maybe you're low on oil, or maybe the engine is overheating, or maybe the transmission is off, or there's a serious problem, and if you ignore it, maybe your engine's going to break down and it's going to cost you thousands of dollars to fix it. In the same way, if someone has these reoccurring headaches, maybe it's a blood flow issue to your brain. Maybe it's a bulging disc or arthritis. Maybe there's a bit of a whiplash syndrome or an instability in your neck. These are issues that, if they go unchecked, can lead to more significant health problems down the road. So number one, tension headaches are nothing to be ignored. Now the question is, what do we do about them, right? What if you went and you had the check engine light turn on in your car, and you went to the mechanic and said, hey, I've got this engine light. I didn't want to ignore it because it could be something else going on. I just wanted you to look at this light. And the mechanic said, not a problem. And they get out some black spray paint, and they shake up the can, and they spray it over the check engine light so you don't see it anymore. And then they give you a bill for $50 to $100. Would you be satisfied? I don't think so. I don't think you'd be satisfied, because you know darn well that check engine light was there for a reason, right? Same thing happens with these headaches, these tension everyday headaches that people have. If they're happening on a regular basis, and people are continually taking medications like a Tylenol or an aspirin or a Motrin, may I suggest that even though those medications are effective at blocking the pain, that it's very similar to black spray paint blocking that check engine light. So don't ignore the dashboard, right? Don't ignore those symptoms. They could be a sign of something serious going on under the surface. So if you know somebody, or you yourself have been dealing with tension headaches, or any kind of dashboard symptom that's just nagging your body on a regular basis, what I would highly encourage you to do is to message us or share this video with those folks. If they're in an area outside of Western Pennsylvania, then I'll be happy to connect them with a qualified upper cervical chiropractor or another healthcare provider that I think could help them out in their situation. If they're in Western Pennsylvania, then by all means, we'd be happy to help out. So hopefully this gives you a little bit of an insight, or a different way to look at some of these common signs and symptoms that people deal with every day. I'm Dr. Bulow, and I'm with Revive Upper Cervical. We'll talk to you guys next time. Bye now.